Alexander Fleming in 1928, unknown to him, he had changed the climate of medicine with the introduction of antibiotics. We are with Dr. Edmund Michael, a renowned doctor in Trinidad and Tobago, American trained in family medicine. Yes, Dr. Michael. Dr. Michael, in the 1930s, with the introduction of Prontosil and then the mass production of penicillin, it has really changed the climate of medicine. Would you say that?
Absolutely. Prior to that, what happened is that many people had infections which obviously would have been susceptible to antibiotics, but when they did not exist, obviously, you had many deaths resulting because of the lack of antibiotics. Penicillin basically has been a game changer.
Yes, because a century ago, they were dying from tuberculosis, they were dying from pneumonia, they were also dying from influenza.
Very much so. Perhaps I think it would be instructive to talk about the antibiotics, simply because we have a situation where antibiotics are very much abused, not only in this country but in many parts of the world. As a medical doctor, I have patients coming to me with a simple cold and they want to get antibiotics. And unfortunately in Trinidad, many times they go to the pharmacy, ask for an antibiotic for a viral infection, and of course the antibiotic does nothing because antibiotics work against bacteria, as you so aptly pointed out. So that with the abuse of that, you therefore started developing resistance.
Antibiotic, for the viewers who may be watching and wondering, we all use it, but what really are they? They would fight or inhibit the growth of bacteria, not viral or virus. Yes, doctor?
Absolutely, you were quite right, 100% right. Unfortunately, I think there are many people who don't really appreciate that fact, and they come to the doctor again, as I said, and they're insisting that they want an antibiotic for a cold, which will never work.
And a cold will come under a virus infection and not a bacterial infection. You were mentioning antibiotic in terms of its roots, meaning to say it is of Greek origin, antibiotic, coming anti meaning against and biotic meaning life, against life, or opposing life, some may say. So these antibiotics supposed to work hand in hand with bacterial infection. But yet still we are seeing, even in medicine and dental world, that antibiotic, it is being overused or abused.
Absolutely, and of course, as I said just now, it causes, unfortunately, a lot of resistance, and therefore a lot of it uses its efficacy. Let me give you an example. I am an American trained doctor and I do a lot of cultures for any infections that I get.
Yes.
And I'm seeing that, for example, a drug like ampicillin, which was heavily used, and patients will go to the drugstore and say, I want to get some penbutin, which is ampicillin, and they use it inappropriately. So that by the time I started doing my cultures, I started seeing something like 25 to 30% resistance.
Wow.
And so the drug often, to a great extent, started becoming relatively useless in my book. And that's because of the abuse.
Mm-hmm. So for a person who may be watching and not quite understanding what you mean by antibiotic resistant, it just means that now the body, because these bacteria, they have been here long even before us.
Absolutely.
Right? And these bacteria, what happens after taking antibiotic or abusing antibiotic, your body now, it becomes resistant in that it no longer would fight off these bacteria as it should.
Absolutely.
Yes? Dr. Michael, there is no one antibiotic to fight every bacteria. There are specific antibiotics for specific bacteria. Is that true?
Very much so. For example, you have the basic antibiotics like penicillin, which will fight pneumococcus, which will fight streptococcus, for example. When you find that therefore after a time that the efficacy of these particular antibiotics started decreasing, and so you develop stronger drugs like the cephalosporins, and which is stronger, and then you had a higher generation of these cephalosporins. And we also have macrolides like erythromycin, which is really very good drug, and azithromycin. And we also have drugs like gentamicin, amikacin, which we often use for patients who have resistance to, and sometimes the only drugs that work is like the amikacin or the gentamicin, for example. And these drugs are can be very hazardous in its own right.
Yes, so with the abuse or misuse of antibiotic, Some common symptoms, I know you mentioned to me, like kidney damage to the kidneys. What other damages can be had from abuse or misuse of antibiotics?
Well, kidney is certainly one of the major problems. You can have, if you're using a drug like say gentamicin and you don't carefully monitor it, you'll find it causes damage to the kidney. Even some drugs like NSAIDs, like Orphan and some of these other drugs of that nature, Voltaren, etc. Those can cause, when abused, can cause kidney failure in the long run by damage to the kidney, and those have to be used wisely. I had one patient who had arthritis, and her answer to using arthritis was simply to take as many as many Orphan as she could. Not certainly not with my advice, and even against my advice, she ended up dying of renal failure, as an example.
Dr. Michael, in terms of medical advice, sometimes you will see doctors in the prescription saying this antibiotic should be taken after meals. What is the correlation with having a meal or not having a meal and taking certain antibiotics?
There's been a lot of misunderstanding as far as that is concerned. As a matter of fact, most antibiotics can be taken with food. But there are some, like say a drug like azithromycin, which you should take 1 hour before a meal or 2 hours after a meal. But in most cases, you can take an antibiotic with food. The old thought was really that if you take it on an empty stomach, it will have increased efficacy, but really in reality, you can take most with food.
Dr. Michael, the question of the day, COVID-19, the coronavirus 2019, with the advent of this virus in Wuhan in China in December 2019, we understand that this is a viral infection. Some doctors were also prescribing antibiotics to treat this viral infection. Listening to what you have said just now, you said that antibiotic will treat bacterial infection as opposed to viral infection. So would antibiotic be effective in treating the coronavirus?
No, there's one thing that you should understand. You can have started with a viral infection, but sometimes you can get a bacterial superinfection. If you get a secondary bacterial infection, then it's appropriate to use antibiotics. But let me talk very briefly about COVID-19. It comes from the same class of coronaviruses that you would see, for example, with SARS, yes, and with MERS, which is Middle East respiratory syndrome. What you find, therefore, is that it's very, very dangerous. As you can see, it's killing a lot of people. They're trying to find a vaccine for it, and I'm sure at some point in time, just like they did with Ebola, they probably will develop a vaccine. But there is a case of a Spanish man who used a drug called Caletra, and together with interferon beta.
That was in Spain.
In Spain, yes, and the patient survived. And I think I can understand some of the logic behind it, because Caletra is what you call a protease inhibitor, which is used.
But isn't Caletra HIV drug?
That is correct. Mm-hmm. But basically how it works is that it's called a protease inhibitor, and therefore it prevents the virus from replicating, from making new ones, from new infections.
From copying itself, yes.
That is correct. So therefore, with this COVID, the same thing happens, the same principle, and that's probably how it worked in this man. And my understanding is that the people in China, especially in Wuhan, are trying to see if this type of therapy would be of use in their present scenario.
Dr. Michael, when would you recommend the use of antibiotics?
I will use prophylactic antibiotics. That means giving it in advance, even though the patient may not be problematic. For example, if you're having certain surgical procedures where you think there's a high risk of infection, you can give certain antibiotics in advance. Also, children, for example, who have asthma, if they have a cold and they haven't even had a full asthmatic attack, and you are worried that might happen, you can give some antibiotics in advance because of the risk of the children, because those children with asthma are obviously have a greater propensity and a risk towards developing pneumonia, for example.